This is Krista Michener. Welcome back to Made to Behold. This week we're going to be talking about tools you can use to discover and discern truth in your quest for health. Stay tuned. Made to Behold is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Behold. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing. So we talked a few weeks ago about the questions surrounding vaccination, what's safe and what's not safe. And it's, as we stated, an uncomfy position to be in, to feel like what you know and have been taught is challenged. But I think we can also put ourselves into a hole when we feel like we have to know now what's right and what's not right, and we don't allow ourselves time and space to discovery. So I can say, I'm questioning a lot of what I've been taught, but I don't have to know in this moment exactly what recommendations I would give to people and become an expert. I need to know this is a time to open up my mind, to gather information, to be open-minded. Sometimes you're doing your research and your data gathering and answers come down the road, but all the preparation you do will get you there. So for example, if you have mysterious health problems, which unfortunately, I have a lot of patients who have had that. It's not unfortunate that they're my patients. It's unfortunate that their life has been that way. What is super helpful though, is when someone has been able to gather information, gather data, without having had to make all the conclusions. They're keeping track of what happened when, and it's not too late. It's not too late if you haven't been doing this all along, but they're keeping track of what happened when, and they can observe what happened in relation to something else, because you don't have to decide whether or not something's causal. It's always worth mentioning. If you started X thing or stopped X thing and this other event happened the next week, I want you to record that. It doesn't mean you have to decide whether or not that's related, but you're looking for patterns, and you need to be not afraid of truth wherever you find it. So I'm going to talk a little more about my journey with this nebulosity that exists when we're trying to break things down. So in the context of vaccination, we talked about that last time. Correlation doesn't equal causation, but we have to pay attention to correlation to see if it's causative. So what that means, correlation means these things happened in relationship to each other. So just because, I ate pizza every time my basketball team won, which isn't true, I don't really eat that much pizza, but somebody could say, when I eat pizza, they win. When I wear my lucky shoes, I win the race. Well, that's a correlation. Those things happen together, but it's probably not causative. And so a lot of statements get made in the world of medicine that are correlation, and we need to pay attention, because what that should do is it should prod us to find more information. So one thing, I'm going to read the data that I found, and if you have data that speaks otherwise, I welcome it. I'm not trying to be a disciple of one side of things or the other, but I found some interesting data about the prevalence of sudden infant death syndrome with vaccination. So most of the time, 90% of the time, SIDS happens when someone's less than 6 months old. It's a really tragic thing. You probably know someone or aren't too far removed from someone who suffered this, where you have a perfectly healthy child who passes in their sleep for apparently no reason. What is interesting to me is the data that the CDC's, it's called Vaccine Adverse Event Reporting System. It's VAERS. The data they looked at between 1990 and 2019, nearly 80% of cases of SIDS happened within a week of vaccination, and almost 60% of them happened within 3 days. There was a peak at day 2. And again, somebody can say, well, that doesn't mean it caused it, but Dr. Elizabeth Mumper, who is a pediatrician and a very, I believe, thoughtful scientist, said, many parental reports about a baby dying suddenly start with the phrase, he was just at the pediatrician's office, they said he was healthy. If there were no correlations between vaccines and SIDS, then sudden death causes would be evenly distributed throughout the month. Instead, we see clusters of unexpected deaths in the first week after shots are given. Reports from police officers and first responders are supported by this published evidence. So I thought that was a very good assessment. She's not claiming causation, but she's saying if these correlations were random, you would see this more even pattern. But when you look at the graphs, like I said, the peak is at day 2, but the vast majority are in those first 3 days and 80% within the first week after vaccine administration. And what is even more concerning are the vaccines that have multiple strains in them. So they're bivalent, trivalent, but the hexavalent vaccines are usually given at ages 2, 4, and 6 months. And they have a much, much higher risk because it's a much higher inflammatory response that we're triggering. So vaccines, the way they work scientifically, they don't just magically confer immunity. They trigger this inflammatory response in your body, trying to get your body to produce antibodies so that when that infection comes around again, it will recognize it and be able to effectively fight it, which is an absolutely fantastic motivation. But what are the unintentional consequences and what risk balance should we go with? One of the books that I've just started reading, which I think is good, and I'll hold it up here, it's Miller's Review of Critical Vaccine Studies. So the thing I like about this, it's got a summary of studies, but because it also has the link to all of the studies, it's something I can go review myself. So I'm not just relying on someone else to summarize something for me and make conclusions. I can dig into that. But one of the things that I think is interesting is that there are a lot more allergic diseases and asthma that are correlated with vaccination. They found that there are a lot of things that people who actually had measles have better outcomes with some other infections down the road. Now, I'm not trying to say measles is a no big deal disease. Obviously, it can cause significant problems. There's been a tragic death recently. We don't want to pretend that the infections are no big deal or there would have been no drive for these vaccines to be created. But we're looking at little snippets of data instead of the big picture. So what are all of the things that happen? Are the unexpected consequences minor, like soreness, or is it something serious like death or longer term disability? Another thing that I think is interesting when you see the backlash against people who speak up or are willing to question things. Unfortunately, if you look back in history, you see a lot of persecution of people who bring forth new scientific ideas. You know, people who thought the earth was round, for example, were persecuted. Dr. Semmelweis, I'm going to read this little gem from Dr. Thomas's book, and I knew the story, but I think he did a good job telling it. So child-led fever, which is something that frequently happened after childbirth, as doctors took over the job of midwives, they would often go from autopsy to delivery without washing their hands. So obviously there was germ theory wasn't a thing at that point, wasn't well known. So Dr. Semmelweis, working at a hospital in Austria, discovered that having doctors wash their hands before delivering babies significantly reduced these infections and deaths. The epidemic of mothers and babies dying was documented as early as 1746, when 50% of mothers died after giving birth at the Hotel Dieu, a hospital in Paris. In Semmelweis's time, when doctors and medical students followed his hand-washing protocol, the maternal mortality dropped from 32% to 0. Despite this obvious success, Dr. Semmelweis was professionally attacked, tricked into entering an insane asylum, and was beaten when trying to escape. He died 2 weeks later from his infected wounds. That's kind of a dark place in medical history, but it brings up this pattern that you see of people who bring up uncomfortable truths. And I really don't know what would be so challenging about the idea of washing your hands. Like, I don't know, even pre-germ theory, autopsy, I don't know, it's kind of cringy. But there's unfortunately a pattern of persecution of people who challenge norms. And I'm not saying everyone who challenges a norm should be hailed as a hero and that they are always on to something. But as I've said before, we shouldn't be afraid of questions. We should be excited by questions and excited at the opportunity to answer questions. Now, there can be a couple of different reasons that a physician, nurse practitioner, healthcare provider, whoever, doesn't want to answer your questions if you bring them up about any number of things. Sometimes it is time constraints. Sometimes, though, it's because they are doing what they've been trained, and we're trained to treat by guidelines. And we're not trained, unfortunately, to know the background of the guidelines. These are the guidelines, this is best practice, this is what you do. And if that were really the way to health, like honestly, a computer could take care of people. You know, you put in your name, date of birth, yada, 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 and it tells you what you need to do, you know. And I think that's why so many people rely like heavily on things like the internet, because they can do a more in-depth investigation with their browser than they can with their provider. And you've got some providers who just get really upset when patients come in and they've looked things up and they think they know something, but they live with their symptoms. I tell patients all the time when they say, well, I'm not an expert. I say, well, you know what? You're an expert on your body because you're the only one that's lived in your body. You're the only one that's lived in your body. And so you have the most data, but what you can do to make your healthcare visits more effective is summarize the data for us. Find these patterns and summarize it, because time is more limited than we would like it to be. So if you go into an appointment with like, this is what I really want answered, if I really need, lead with the most important things. Don't say as your provider's walking out, oh, by the way, X. If you're organized and can be a good advocate from the beginning, then you're going to get more out of the appointment. So something else that I have been challenged my previous view when it comes to vaccine safety is the safety of vaccinations given to pregnant women. My first kind of run-in with this was during COVID, how you had so many people who were being mandated in healthcare and other workplaces to be vaccinated. And I became acquainted with someone who had had the first vaccine pre-pregnancy, but based on some of the safety data she was rating, didn't want the second COVID vaccine until after she gave birth to her child, which was a completely reasonable request. You know, she was the one taking the risk, not the one surrounding her. And I did provide a letter in that case. I'm really cautious with letters. There are a lot of people who would love you to just write vaccine exemption letters for everyone. But the challenge you get into, and hear me out on this, is not being cowardly and not wanting to help people who have real concerns. But the challenge is, because we have overzealous professional boards, that is opening yourself wide open for investigation and for a witch hunt and possibly losing your license. I have provided a few letters when I could provide sound evidence that correlated risk with that patient's underlying conditions. But one of the things I think that has happened post-COVID that is beneficial, more people have stood up for themselves, and more people have been willing to take a stand and maybe walk away from jobs or professions where their autonomy was being challenged, where they weren't allowed to make choices that they thought were best for their health. I found it super ironic during COVID that you had all of these nurses and other healthcare professionals who were the ones on the front lines working before there was a vaccine available, literally risking their lives to take care of people. But then once one was available, they weren't allowed to take that risk anymore, or they would lose their jobs. And unfortunately, what you saw happen is the idea that, well, you can just bully people into this by mandating it. You have a lot of people who walked away from the profession, and then you had the people who were left very, very short-staffed, a lot of PTSD from hospital workers who were working insane numbers of hours, asking to do horrible things, people being isolated from their families. And this really could have been managed with a risk-benefit and an acknowledgement that we didn't have all of the facts. And maybe we could have done this. It wouldn't have been a randomized control trial, but what if we said, okay, well, you're choosing not to vaccinate. Can we track your health data as a comparison against outcomes for those who did? Let's make this part of this ongoing trial, because it's what it was. Whenever there's emergency use authorization like there was for the COVID vaccine, there hasn't been time to explore and do all the normal safety checks. So we could have embraced that and kept our healthcare systems more robust. So I got off on that side rant when I was talking about vaccination and pregnancy, which I previously would recommend to people, but there were a couple of different things that I have been exposed to recently that have changed my tune. So the CDC Advisory Committee on Immunization Practices, this was in May 2008, so it's a little older, but they said the safety and efficacy of using Tdap, which is the tetanus, diphtheria, pertussis, in pregnant women has not been demonstrated, and Tdap is not recommended for use in pregnant women in any country. No evidence exists of excess morbidity or any fatality among pregnant women ascribed to pertussis. No evidence exists demonstrating whether it harms the fetus or increases the risk for adverse outcomes, that transplacental antibody production is going to protect the baby, yada, yada, yada. So they're not taking a stand saying that it can cause harm, but they are actually stating we don't have any evidence that it's safe. It's not been demonstrated. So I think that being very, very cautious with prenatal health, and prenatal health really needs to start preconception. Here is my dream world for helping women have healthier babies. I am not an OB, I'm not a midwife, I have no interest in being any of those things. I take care of teenagers and adults. But what I would love is for anyone who wants to have children, and this would be mom and dad, came in and had really good micronutrient testing. We addressed all of their nutrient deficiencies. We got those maximized. We checked for any sort of infection, especially doing a vaginal swab and a semen sample, because those things are going to directly affect the health of the baby. And we get the immune system in really, really good shape. So first of all, mom doesn't get super depleted during pregnancy, delivery, breastfeeding, because all those things are a huge demand. Her immune system is able to handle threats. She's got a much lower risk of postpartum depression without some of those very specific deficiencies that we sometimes find with postpartum depression. And we really, really value what women do. Well, one of the things that came up repeatedly during this MAPS conference I've referred to the last few weeks was the well-demonstrated benefits of breastfeeding for an infant. And I examined that a lot in my mind, trying to figure out what are the barriers for doing this. I have 6 children, one's adopted. I didn't breastfeed him because I got him when he was older. Of my 5 bio kids, I breastfed 3. I didn't breastfeed 2 for various reasons. I don't think you could look at them and pick out which ones were breastfed and which ones weren't. But I got to thinking about how difficult breastfeeding is, and how really one of the best things we could do for our children's health is to create a culture that really, really supports this, that acknowledges, first of all, if you've got a working mom, that makes it easier for her to pump, but also if you have a mom taking care of kids, that you recognize there's higher nutrient demands. This burns a lot of calories. other people, if you have other people around who can chip in and do more, that's what you can really do. I know everyone would love to come and hold the baby to help out when really they just want to hold the baby. And it is a little bit of a help, but what you could really do is help with other things so that breastfeeding is not so exhausting and overwhelming and one more thing for the person to do. I know with my oldest one, who I did breastfeed, like it was like a full-time job because I'm learning how to do this. I'm a new mom. He wasn't particularly great at it. Some kids are better at it than others. And it was very consuming. And then you think about trying to do that with subsequent children, depending on the needs of other family, and you're trying to take care of, keep all these little people alive, or you're trying to work and you're trying to take care of a house. If we really, really value the health of children, I think preconception care for mom and dad, I think excellent, obviously prenatal care, but then rather than pushing vaccines during pregnancy, that we could really, really help support breastfeeding, support other these things that are so like unequivocally linked to better outcomes. So a couple of facts about vaccination during pregnancy, which is one of the reasons I did write this letter for the COVID vaccine. But pregnant women who received the COVID vaccine plus a booster were 3 times more likely to experience postpartum hemorrhage. And we saw there's a lot of clotting risk, and 1.5 times more likely to be diagnosed with gestational diabetes. That's an article you can find on PubMed that documents women who had the trivalent flu vaccine prior to conception had 155 times higher risk of having a miscarriage to people who did not get that vaccine. So, and obviously they don't do clinical trials for vaccines in pregnant women because it's considered unethical to do clinical trials in pregnant women. So just kind of think about that. And this, again, this is not to say like, oh my gosh, what did I do to my baby? I'm a terrible mom, or to create fear. This is to just create a conversation and say, you know, even though this puts me in the out camp with some of the scientific community, I'm very intrigued by these connections that we're finding. And I want to share this information because I want healthier moms and kids. I look back, I have a whole house full of very sick kids. And I don't think they're all very sick because they were vaccinated, but is the fact that we followed that vaccination schedule made their immune systems more vulnerable, so they possibly had more severe outcomes with these chronic infections that they've been dealt with. It could be a piece of the puzzle. And in retrospect, if I knew what I knew now, I would not have followed the vaccination schedule that I did when they were young. And I don't feel guilty about that because I didn't know any better. And I don't think you should feel guilty either. But I think the more we can raise awareness, the better, because that's going to help. We know an epidemic of chronic illness in this country. Anyone over 40 or 50, how many kids did you know in your class growing up who had autism, who had severe allergies, asthma, those sorts of things? It's just skyrocketed. And I'm not saying this is monocausal, but if this is contributing to impaired immune function because the immune system's being inappropriately stimulated and we're causing inflammation and other things, then let's revisit it and let's find a way to create a safer, healthier future. So that's all I have on that highly contentious topic, but I just wanted to continue to share what I'm learning and encourage you to not be afraid of truth and to be aware of a couple of different tactics people take when they're wrong. Now, some people, in my opinion, will fall into the camp of stirring people up. You know, they're very contentious. They like to create division. I would be aware of that. I would also be aware of people who go the other way and like are pacifying everything. Everything's fine. Everything's fine. You have nothing to worry about. Or that just flatter you. You know, flattery is another way that people are deceived. You need to be aware of those 3 paradigms when you're getting fed information. And if somebody's trying to enrage or divide you, to pacify you or flatter you, I would be very cautious about how you interpret the information that comes from them. They may be saying some things that are good, but that's a problem. I would also recommend caution and maybe looking for another provider if you're seeing someone who says, we've figured this out, we have all the answers, we don't need any more proof. If they're not open to your inquiry, then they're probably not following research, they're probably following guidelines. And guidelines are okay. It should be great to follow guidelines, but I would much rather be seeing someone who doesn't have all the answers, but is reading things and going to conferences and trying to understand research and not just following guidelines. And I would also be wary of people who get really, really angry when challenged, because really, even though it's uncomfy, we should be happy when we have new information. Truth is truth, and truth in any form is welcome. So seek truth in your life, see truth in your healing journey, and remember to have hope because you were made to be whole. Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.